So we are up to our fourth presentation, which is by Beth Tarleton. And Beth is a senior research fellow with the Nora Fry Research Centre at the University of Bristol. And there she is working with Kelly Johnson, and some of you might know Kelly because she worked here and she was involved in work with setting up the Inclusive Research Network and with Trinity College. And we are delighted to have you here, and we are looking forward. So your presentation will focus on people with intellectual disability or learning disability, or in Britain they're often referred to as people with learning difficulties, which is different with here, like with the Irish terms we use. Okay? Thank you.
That's my first slide. You talk about intellectual disabilities, and lots of other countries do. We talk about learning disabilities or learning difficulties, and I tend to use the word learning difficulty because that's what most of the parents want to be used. But lots of the guidance talks about learning people with learning disabilities who've got a diagnosis. But what I'm actually talking about is that far bigger group of people with learning difficulties who haven't got a diagnosis of having a learning disability, that they haven't got that IQ level of 70, but they're higher than that. They've only got mild difficulties, but they still have big problems with their parenting. And as Harriet says, the risk lens falls on them very clearly, even more so probably because they often haven't got any services in their own right. So I just thought we'd get confused about words, so we'd say it again. So I'll talk about learning difficulties, but I mean intellectual disabilities, or any of those. And other people, you will notice, say learning disabled or mentally disabled, and in some countries they still say retarded. So, but we'll go with learning difficulties. But we work in England, and there is no reliable data on how many people there are. The network we run has estimated there are 53,000 parents with learning disabilities, actually the diagnosis, and they've done that from just calculating up from the national survey. But that's only the very small group who might have a diagnosis. How many people there are with learning difficulties who are just struggling, we don't know. We only know about the ones who've come into contact with services, and then there's seen to be a problem or an issue. So what are these parents' lives like? Well, I think you could describe them as the most vulnerable members of our society, really. They're people with learning difficulties who face all those things that people with learning difficulties face: discrimination, poor housing, living on benefits, all of those things. And they have children as well. So they really should be deserving of extra support, and all the policy documents around family support say that families should be supported, but often that doesn't apply to these. It doesn't work somehow. When you get into children's services, it all becomes risk. It doesn't think about support much. So the parents we know about are the ones that get involved with children's services, and they're likely to be unemployed, live in poverty, be harassed. They've often got mental health support needs as well as their learning difficulty, and have issues with substance abuse or domestic violence. Sometimes they've grown up in care, so they don't have any role models on how to be a good parent anyway. So, what are their children's lives like? Well, there's not much research on this, but it's very clear that children love their parents and their parents love them. But also, from research from the learning difficulties side and from the child protection side, say that children do have very high levels of need, and there's no getting around that. But it's often linked to the parents not having the support to know what to do. Children are often bullied because of their different parents and forgetting their PE kit or whatever else might be going along with having a parent that might struggle with remembering things and time or reading letters from school. And the children recognise their parents' need for support but have issues with how it's presented often, because parents often speak about having 5, 6, possibly up to 10 professionals involved in their lives. So what inhibits their parenting? Well, it's been mentioned before. People with learning difficulties also often get viewed in a very childlike manner. People don't expect them to have children or even to have sex. And then often there are assumptions about their ability to parent because they've got a learning difficulty. So people just assume they can't because they've got a learning difficulty, so there's no point in actually trying to help them to develop that because they can't do it. And there isn't the opportunity to develop the skills they need anyway. How many of us think of our person with learning difficulties we know in our community as our babysitter? How many people who gets that? They don't get that sort of experience. So what are the concerns about their children's welfare? Well, it's generally neglect by omission, which is the technical child protection term. It's inappropriate childcare. They're not doing it right, or they're not meeting the basic standards, not deliberately abusing them, but failure to protect, or not providing the right food, not getting them to bed on time, all those things that stack up to the children not actually fulfilling their doing as well as they could. And Cleaver and Nicholson is a really good, it's quite a big book from a childcare perspective that's really looked into these issues. And they say that parents with learning difficulties do have big problems, and the children do have big problems, but it's down to a lack of parental education and support services for these families. And they did a really big study, and they don't see it as deliberate, but lack of knowledge. Okay. So we've already heard a bit from Harriet about the issues with the risk lens, and so we want to talk a bit about that. And this slide is how do parents and services interact? And I've put, well, if there is respect for the parents and professionals who work with them really want to think about helping them and supporting them and understanding their situation, and if individualised ongoing support can be provided. There's a picture there of skills cards. It's got step-by-step instructions on how to do things. And if services work together in a multi-agency way, which we'll talk about in a minute, that it is beginning to happen in some areas in England. But this one says, how do parents and services interact? Well, not very well at the moment in lots of places, because parents feel that those services have little experience of working with them, that the professionals aren't trained to present information in a very easy way, in a concrete way, so that they can understand it. They feel that there are assumptions made about their abilities before they even start, and that the sort of support that's available from child protection services is short term. So they might get sent on a parenting course, and they're expected to go on that course, take on the information, and everything be fine, and children's services walk away and think issue dealt with. But it doesn't work like that with parents with learning difficulties, or anybody with learning difficulties. If ongoing support is needed, it's needed, but that isn't generally available at the moment. And also there's quite a big problem between the number of people involved with parents with learning difficulties. There's their own social worker if they've got one, the child's social worker, the midwife, the health visitor, the school teacher. They all have different views often on what is good parenting for that family, and a consistent message doesn't come across to the parent as to what they're meant to be doing, and they often don't know which professional they're meant to please. So they get very confused and end up not engaging with services. And there is also the big fear when involved in any child protection or children's services that children are going to be removed. So parents are starting from a really scared position, which makes it difficult for them to engage in the first place, because anybody involved with those sort of services are scared and wouldn't think clearly. So, what guidance is there? In England, there's the good practice guidance, and there's good practice guidance in Scotland too, and it's on its way in Wales. The picture on the screen is of the easy version of the good practice guidance in England, and that was written, the easy version was made by an organisation called Change, which is in Liverpool, and they do lots of campaigning and work around support for parents with learning difficulties. And if anybody's interested, they sell photo banks and books, baby books. There's you and your baby 0 to 1, there's a small child book 2 to 5, there's pregnancy books, there's books about contraception, all in easy words and pictures. And I think I mentioned before, all the policy, or the early intervention policy says that there should be support provided. So the good practice guidance actually fits with all the early intervention and preventative policies that are together. So with the guidance, basically, starts from the same premise as any other guidance around working with any vulnerable family, that children should be safeguarded, but it recognises that these parents have specific support needs, and so the services should make the effort to make that term reasonable adjustments, so that parents can access all the services available. And it's expected that all services should make those reasonable adjustments for parents with learning difficulties, but in reality, very few services have made those reasonable adjustments. You don't find many parents with learning difficulties in your local children's centre, generally, because they often don't feel safe or comfortable there. So the guidance actually does work from the social model approach that Harriet mentioned before, that the problem shouldn't be seen in the person, but on the things around them, the barriers to their parenting, the poor housing, the lack of skills. And so the good practice guidance has 5 elements of good practice, and they're basically how you should work with any parent, really, to make sure that they're informed. You should provide them with accessible information and communication, and so that's making sure the way you say things is really clear, as well as information with pictures on or on DVD or in whatever format is right for that parent. That you should have a clear and coordinated approach to referrals and assessment pathways. In lots of areas, organisations have got together and worked out pathways of how they're going to work with parents when they come into the system. And the support should be designed to meet the needs of the parents based on their strength, beginning from their strengths and their capacities and what they can do, and build on there, not look at what they can't do. That long-term support should be provided where necessary, and there should be independent advocacy, particularly if parents are involved with children's services. So this, just a final bit about what supports their parenting: competency building support, and there's been lots of work on how you can do that, but you need to really work from the parent and see what they can do and what they need and what steps they need at what time. We've mentioned easy information. Those are some of the pictures of the change materials that can be bought, and to support parents getting over any personal traumas or the domestic abuse or the other things that are happening in their lives. So competency building support, that would look like making sure there's a network of people around the parents that can help them. It's been said that if family members are supportive, children are far more likely to stay with their parents because they've got a network of support. Looking at what the parents can do and building from there, helping to increase their confidence and helping them to learn the skills and understandings they need in a very individual way, hopefully using the equipment and in the environments they will parent rather than in an assessment centre somewhere. And making sure that they've got relationships with people that carry on, so that those professionals or family members or home start people are there and can see things. If they're beginning to go wrong, the issues can be dealt with before they go really wrong. And the next point was that services ought to work together in a really coordinated manner. There should be a key worker for parents. There should be ongoing communication between all of the organisations. Frontline workers have talked about having communication books and monthly meetings to talk about how they're working with that parent to make sure it works. And at a higher level, there are protocols and pathways being developed around the country to show how organisations like health, social care and all the voluntary organisations can work together. And there's a good example there of Suffolk Accord. You can just Google Suffolk Accord and it'll come up, and there's reams of information there. So where's this good practice developing? Well, in areas basically where there are interested professionals who have fought the corner of parents with learning difficulties in their area. Normally when a case has gone wrong and they think children have been removed when they shouldn't have been. And in those areas, that's where the good practice guidance has been used and where they've developed the joint policies and protocols, really. So what do we need to do in England? In England, we're trying to get involved with the early intervention agenda. It's very strong at the moment that we should help families and we should keep them together, and so we've got to make people aware of the needs of parents with learning difficulties within that. There are lots of workers around the country trying to share their experience of learning difficulties with mainstream workers so they can understand and know how to adapt their practice to work with parents with learning difficulties, and also helping them to work together so that they can share the costs, which is the biggie in lots of organisations. Who pays for it? Is it a child need or is it a parent need? So in England, how is change being supported? Well, we've got a network called the Working Together with Parents Network, which supports professionals and just provides resources, and if there's any information comes out, then we'll send it around the network so that people know what people are up to. We have quite a few organisations that campaign for recognition of the needs, change being one of them, but there's also lots of parents groups developed around the country now that are supported by local interested professionals, and they then go and do training and work with professionals in their area. Trying to get positive stories into the media, but that's not necessarily always very easy or very safe, and there needs to be lots of research on the cost of support and the different models and the cost of court cases versus ongoing support. And that's where you can get more information about. The network is at that web address, and we've got a phone number, and also there's lots of information, similar information coming from Australia. They've got a network called Healthy Start, and they've got a big national organisation, a website with lots of information. And if you are involved with IACID, then there's information there too. Yeah. Thank you very much.